It's very easy way, okay?
Okay, real quickly, Dr. Wang, can I ask to see if I understand the palm diagnosis correctly? Okay, gonna summarize what you just said, okay? See if I got it right. Number one, when you're looking at your own palm, look at your own palm right now. Do you see any dark veins anywhere? I have dark veins. The darker it is, the more severe it is. More stagnation, more cold, correct?
More cold is more deficiency. Yeah.
More deficiency causing the cold. So you have any dark, blue, black, purple veins, that's that indication. Next, you look at the palm, okay? The palm, the areas, like he said, this is the lung. And what was this one? I forgot.
This is a 五间穴.
Oh, so this is the lung area.
The lung area.
And this one is, I wrote it over here. This one is the heart area here. Yeah. Okay. And then in the, over here, liver and spleen over here.
Yeah, not right down. Not
liver and spleen. And then kidney over here. So in these areas, what you're looking for are the veins as well as the discoloration. So what you see some people have is, can you zoom in a little bit, Sam? In this side of the palm, on the side, this whole area is red. Some patients you'll see only here is red, or some patients you'll see some areas are yellower than the other, or the whole shade, it's like, it's not a vessel, it's the whole impression of that area. The color has turned to either orangish, reddish, darkish, or whatever. And those are indications that organ has a pathology. Okay, so when he was saying, for example, like in this lung area, if this area looks white to you, that means the lung has its own organ problem, deficiency.
Yeah.
And then what he was then saying here later is if the color, he was talking about the color. For example, the water area. The water area is supposed to look more black, right? Because that's the color that goes with kidney. Supposed to be darker than other areas. But if it looks...
But you should say like this way, okay? If you have a kidney disease, this one in here should be more dark, more blackish.
Okay, okay.
Yeah. But if you should have a blackish in here, it's not blackish and the change to be the more yellow. That is earth conquer this one.
Yeah.
It's a more severe condition.
So like this, another one is easier. This is heart, right? Heart is supposed to be red, right? This area. But if it looks like it's black, so what do we have here? This is fire, right? Fire is supposed to be red. So when you have the water overacting on the heart, then that's a severe condition. Then that area appearing black will give you an idea that you should really treat the kidney. Is that right?
Yeah.
Don't treat the heart because the kidney has the problem.
It depends on the condition, okay? Depends on where you insert needle, how to insert needle.
Okay. And the last thing he said about the wansun over here, the points, how to pick channels to treat back pain. Essentially, you need to palpate what he was saying. You palpate the three-channel lingu dabai area, the large intestine channel, sanjiao channel, and the small intestine channel. You palpate for where there's most pain in the patient. Then you stick a needle there. Or you palpate where the muscle feels the weakest.
Yeah.
Then you stick a needle there. You will get much better result than just sticking it anywhere. So you always need to palpate. That's why in the beginning he was saying palpate with your middle finger. And when you feel where it's weaker underneath, like it feels hollow or if there feels like a knot, then you stick the needle right where that is. Then you'll get much better result.
Yeah.